Are you a teacher or a parent of a child between the ages of 5 and 14? Are you struggling to figure out what to tell your child about this once in a lifetime situation of the coronavirus? Are you concerned about how to tell them in a manner that reduces their anxiety? I am here to help you out. Watch this video till the end and decide if you are okay to play it for your kids. I assure you, they will benefit a lot from the honesty and clarity of the message in this video. Please listen to your child's body language as they watch the video. You may consider allowing them to watch it in 2 parts. I hope you and your kids enjoy this video. After you watch the video, if you like it, please press the thumbs up button. Subscribe to this channel if you would like to watch more videos like these where I address everything related to building up the family unit. Press the bell button if you want notifications every time I release a video. Please share my video on other platforms like Facebook, WhatsApp, Twitter, etc. so that this channel can reach out to more people like you. Enjoy this video. Dear young, lovely people, I am Malcolm Korea. I am a teacher from Mumbai, India, and I would like to talk to you about the coronavirus situation that we are presently living in. I know it has been hard on you to not move around as much as you are used to. You are not meeting your friends from school and in your locality. You are unable to enjoy yourself at the eatery you love. And since this has been continuing over 6 months now, I think it is time that you understand this situation better. This is what you must know about coronavirus. Coronavirus, also called COVID-19, is a disease caused by a virus that affects a person's health and causes him or her to be ill. It affects their internal organs and they may need hospital attention in some cases. It is infectious. This means that the disease may spread from one person who has the disease to another who does not. It is a pandemic, which means that the disease is not limited to a particular region of the world, but rather spreads to all countries around the world. Some countries, however, are more affected and others lesser. All countries are on a watch out to ensure that it spreads to as few people as possible. How does it spread? Persons who are infected cough a lot. Small droplets from their nose and mouth may fall on other people or on other objects in their surroundings. When a non-infected person comes into contact with these droplets and spreads it by touching either their own nose or mouth, the virus enters their body and infects them too. How can we then prevent the spread of the virus? These are some steps that you should take whether you are infected by the virus or not. We should cover our face in the crook of our arm when we sneeze or cough. I'll show you what I mean. This is the crook of your arm, and when I cough, I will ensure that my entire mouth is covered by the crook of my arm. You need to practice this a bit yourself so that you become really good and ensure that no air escapes. You should wash your hands for a minimum of 20 seconds, which is about the time needed to sing the short form of the Happy Birthday song 2 times. There are 3 techniques that ensure that you are applying soap on all parts of your hands. The first technique is this. Open your hands with your fingers apart and rub them like this, such that your fingers are interlocked with each other. The second technique is to wash the back part of your hand. Now this is done this way and this way. The final technique is this. You wash your thumb. You need to wash your hands every time you come back from the outdoors. You can apply hand sanitizer when you are outdoors and in contact with others, or carrying any object from outside. Cover your face and your nose with a mask or any piece of cloth. A mask is highly suggested, but any piece of cloth is better than not covering your face and mouth at all. A mask will stop you from touching your mouth directly and getting infected, as well as stop the small droplets from your mouth when you cough. Make sure that you are covering both your face and your mouth properly. You need to wear a mask every time you go outdoors, especially in crowded areas. Do not wear a mask while doing rigorous exercise, as this can be harmful to your health. Hence, try not to go for a fast walk in crowded areas. You may, however, use a mask there and walk slowly. Your family will make utmost effort for your sake, so you do not have to be overly concerned about protection from them. However, you should try to avoid contact with other persons as much as possible. And if you do not forget to wash your hands. Also, reduce the number of times you leave the house. That way, you can be as safe as possible. Social distancing. This is a term that you may have heard already. The more distance you keep between yourself and others, the lesser is the chance that small droplets will come in contact with your body. If you are unwell in any way or have a possibility that you are infected, do not go out of your house until you have fully recovered. By doing all these steps, you will do your part to be a helpful citizen of the world and reduce the spread of the disease. How will you know if you have the virus? COVID-19 affects different people in different ways. Some of the most common symptoms are fever, dry cough, and tiredness. Other symptoms may include aches and pains, a sore throat, diarrhea, headache, or a loss of taste or smell. To find out definitively, one needs to go to a nearby testing center where your test result will be ready in a day's time. If you have any symptoms or are feeling unwell in any way, the first thing you need to do is to inform your parents or elders at home. How serious is the disease? There are some persons that are infected that do not get any symptoms. They, however, can still spread the virus. It is important, therefore, that you take all the precautions like wearing a mask, hand washing, etc., even though you do not show any symptoms. Others who are infected may have mild, moderate, or severe levels of the symptoms. Those who have severe symptoms often need to go to hospital for supportive care. This disease is more dangerous for older persons and for those who already have certain illnesses that affect their heart and lungs. When will this end? The fact is, I don't know. No one knows. This is life. We will never be able to perfectly predict the future of anything really. But that's okay. We humans understand that. What is important is that we do the things that are needed to make our tomorrow better than our today. At present, many persons across multiple countries are faithfully following the precautions I have suggested that you too take. There are many doctors who have been successful in using already discovered medicine to help more people who are in hospital to recover faster. There are scientists who are busy preparing what are called vaccines. These will help us to stay safer and will go a long way in getting the world back to normal again. Now that you know about the disease, are you better able to understand why you need to follow the precautions that do not allow you to enjoy with your friends as much as before? On behalf of the entire world, I would like to say thank you for doing your part and obeying your parents' instructions during this time. In the conversations aspect today, I would like to ask you to give your parents more hugs and kisses and keep thanking them for everything they do for you. They too are missing being with their own friends, so please take care of them by giving them all the love that you can. These days, they are busy doing their office work as well as taking care of the home and you wonderful people all at the same time. They do not have nannies, maids, or daycare to support them with their work. Please be patient with them and caring with them. Thank you, lovely people, and have a lovely day. We will meet in my next video for you. Until then, bye.